Hello, my name is Nurse Pauline RN. Welcome to my channel. Welcome to all my subscribers. Welcome to all the new visitors to my channel. Today we will be focusing on Exam 5, Fundamentals of Nursing. I am trying to do at least 10 exams. So whenever you get a chance, try to read your exams as soon as possible. Do not try to do them the night before your exams. Try to do your exams at least 3 days before your exams, because I have a lot of contents here. I also have a lot of contents in my 49 chapters of Fundamentals of Nursing that's in my playlist, and there are a lot of test question answers that are in those 49 videos that will be very, very helpful. Okay, today we'll start with Exam 5. I'm still having that cough, so I may have to cut my video short, but I'm trying not to. For Exam 5, a patient is diagnosed with multi-resistant organism, MRSA, in a surgical wound. This means that the antibiotics the patient received is not strong enough to kill the organism. The organism has developed a resistance to one or more broad-spectrum antibiotics, indicating that the organisms will be hard to treat effectively. That's for MRSA. MRSA. Patient with a surgical wound that's swollen, red, tender, purulent drainage. Appropriate intervention. Use a septic technique to change the dressings. Reassure your patient or check back with the patient to check the wound later. Notify the doctor of the status of this wound that's draining. Support your patient's fluid and nutritional needs. We're talking about disinfection and cleansing. Proper cleaning techniques requires mechanical removal of all soil from an object or area. General environmental cleaning is an example of mechanical asepsis. Cleaning in a direction from the least to the most contaminated area helps reduce infection. We're talking about vital signs right now. If your patient is on face mask, the temperature will be taken using a tympanic thermometer by the tympanic membrane. When deflating your blood pressure cuff, it should be done at a rate to 2 to 3 millimeters of mercury per second. If you deflate the blood pressure cuff too slowly, is incorrect. If you deflate very slowly, this is incorrect and will likely cause an incorrect blood pressure reading. When a patient has nail polish remover, remove your nail polish when you're checking your patient's pulse ox, because nail polish interferes with sensor function, resulting in an inaccurate reading. Intermittent fever patterns means The patient has an interval where temperature is elevated, followed by an interval when temperature drops back to normal. Very high, then back to normal. This is called intermittent fever pattern. For patients' pulse, heart rate, if it's low, your priority intervention is to assess your apical pulse and evidence of pulse deficit, which is the difference between the apical and peripheral pulse rates. Patients with highest risk of tachycardia, patients with high fever, example, fever 103 degrees Fahrenheit. If your patient has facial droop, patient has stroke, unable to keep your oral thermometer, use your tympanic thermometer to check this thermometer, not your oral thermometer. If your PCT, your tech reports that blood pressure in the right arm is 140/86, in the left arm it's normal, 120/70, the action the RN should take is repeat the measurements in both arms using your stethoscope. Review your patient's baseline also to see what the patient's baseline blood pressure is. If you have a patient who has had surgery recently, if the patient's blood pressure is low, example 70/45, your priority care is to assess your patient's mental status. Repeat your patient's blood pressure. Press your start button on your electronic blood pressure machine to obtain a second new reading. Obtain your manual blood pressure with your stethoscope. Remind your patient not to bend her arm while taking the blood pressure. If a patient is admitted to the hospital and the patient tells you, when I'm at home, my blood pressure is always high when I check it. It's usually 160/80. But on admission, the nurse checks the blood pressure. The blood pressure is very normal. Assess your patient. Ask your patient, what kind of blood pressure machine are you using? Sometimes the blood pressure machines over the counters, the reading is incorrect on some of the over-the-counter blood pressure machines. So check with your patients, and also check, sometimes the cuff of your blood pressure machine is too small. Make sure you check the patient's blood pressure. Know when to use small blood pressure cuff. Know when to use medium blood pressure cuff. Know when to use large blood pressure cuff or extra large blood pressure cuff. Assess if your machine is working properly. Okay, we have a lot to talk about with your health assessment and physical assessment. When a nurse is admitting a patient, she prepares to conduct a general survey on her patient. The assessment the RN performs is measurement of vital signs, while she initiates the nurse-patient relationship. When you're performing an abdominal assessment, first auscultation, first inspection, second auscultation, third precaution, and the last is always palpation. While auscultating your patient's lungs, bubbly sounds heard during inspiration that does not disappear after cough. This should be documented as coarse crackles. Skin assessment: lesion irregularly shaped, elevated with edema. This is wheal. We're still on assessments. Auscultating for your tricuspid valve is located at the fourth intercostal space, left sternal border. Assessing your post-op patient just returning from OR. Assessment requires immediately. You will assess your patient's respiratory rate. If your patient respiratory rate is low, this is signs of symptom of respiratory depression from medications and anesthesia. Teaching detection of colorectal cancer. Patients should check fecal occult blood annually once at age 50 years old. Teaching prevention of heart disease. Talk to healthcare provider about taking a baby aspirin daily. Daily exercise program. Limit intakes of fat. Quit smoking. Position for your physical examination. Positioning is very important in NCLEX. You will get positioning in NCLEX. Palpate the right breast for breast tumor or lumps. Patient lie in supine position. Right arm abducted and hand under head and neck before palpation. Assess cranial nerves. You have to know this. Hypoglossal nerves. This is function position of the tongue, glossal. Trigeminal nerve, motor innervation to muscles of the jaw. Abducens nerve, lateral movement of the eyelids. Trochlear nerve function, downward, inward eye movement. Vagus nerve, sensation of the pharynx. Testicular self-examination. Teach. Start monthly examination. Usually done after a warm shower. Perform examinations in front of a mirror. Gently roll the testicles between fingers. Respiratory assessments. Start at a midline position behind the patient, observing for position of the spine and scapula. Palpate thoracic muscles for masses, pulsations, abnormal movements. Place the palm of the hands over intercostal spaces and ask patients to say 99. RN plans to assess patient's memory. Ask the patient to repeat numbers back to you. Assessment for dorsalis pedis pulse. Have patients relax the foot while lying supine position. Palpate along the top of the foot in line with the groove between extensor tendons of your great first toe. Risk for breast cancer, you'll teach your patients and you'll assess family history. Patients older than 40 years old, onset of menses before age 12 years old, recent use of oral contraceptives. Now we're moving on to medication administration. If you are unable to read healthcare providers' orders for your medications, call provider to clarify order. If one of your patients is unstable, call healthcare provider stat. Administration of oral medications to toddlers. Most appropriate equipment for administration of oral medication is oral dosing syringe to a child. Administration of airdrops to a child. Strengthen air canal before administrating. Use by pulling down the air upward and outward in order to administer airdrops. Appropriate action for elderly with more than 8 medications, history of renal failure and hypertensive medications. Review medication list with healthcare providers. To ensure patient needs all these medications. The elderly has reduced renal functions, so you have to communicate to your provider if your patients are taking more than 8 medications. We're talking about medications. RN administer IV push medication to a patient with compatible IV fluid running. Appropriate step: select IV port closest to the patient. Clean injection port with antiseptic swab and allow to dry. Connect your syringe that you're using to administer your medication to port of IV line. Occlude your IV by pinching tubing above injection port. Pull back gently on syringe plunger to aspirate blood returns. Release tubing. Inject your medication. After injecting medication, release tubing. Withdraw syringe. Recheck fluid infusion rate. Make sure your fluid IV rate did not change while you were administering your medication. I would go back to my clinical procedure book and review this administration of your IV push medications. If patient refuses medications, ask the patient to state reason for refusal. IM injection administered to patient. If patient experience burning, tingling at the deltoid injection site, RN should assess injection site. Notify healthcare provider. Document assessment finding and related intervention in your medical record. If the expiration date on medication in the wrapper, if the expiration date is expired, return this medication to the pharmacy and get another medication. Do not use expired medication. Always check your wrappers. Medications administered through G-tube, gastric tubes. Evaluate each medication. Whole tube feedings before administration. Head of the bed must be elevated 45 to 90 degrees. Positioning important. Flush the tube with water between each medication administration as ordered by the doctor. Medications that are viscous can be painful. Administration of medications via ventral gluteal site. Use Z-track method. Use distraction during injection administration. Healthcare provider do not give verbal order for medications to student nurses, only registered nurses. Medications given to the wrong person. First priority is to assess your patient for adverse effects. Check some vital signs. I have to drink some water. I do not want to end right now. HPV, we're talking about sexuality. HPV vaccine is recommended for males and females and targets specific viruses that causes cancer and genital warts. Know your condom application sequence. Check condom package expiration date. Check package for damage, date, and protection from STI, sexually transmitted infections. Gently squeeze air out of the tip of the condom. Leave space at the tip of your condom. Place the erect penis and unroll to the base of the penis. After ejaculating, hold onto the condom while pulling out. Untreated STI can cause serious complications. Excuse me. My throat is getting dry. After untreated STIs can cause serious complications in pregnancy. Can cause chlamydia. I will have to end. Please hit the thumbs up. Please subscribe. Please share. Thank you.